Good morning, everyone. Thank you for attending the Stanislaus County Board of Supervisors meeting for January 23rd, 2024, and the meeting commences at 9 a.m. If I can please have everyone stand for the Pledge of Allegiance and then an invocation by Carlos Gonzalez from City Ministry Network. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Let us pray. Lord, thank you for your goodness towards our county. Thank you for your grace and your mercy. Thank you because we love our county, but you love it more. Today we pray for those on the Board of Supervisors. You have placed them there and given them this great privilege and responsibility. You have placed them there for the good of the people. So I pray that through their decisions, our county is a place where everybody can live a life full of peace and dignity. I pray that through their leadership, Stanislaus County becomes a good place to grow up in and grow old in. I pray you bless them, bless their families, and give them the grace and wisdom they need to lead this county. Thank you because for such a time as this, you have placed them on this board. So guide them, give them direction, and may they feel comfortable to turn to you in their time of need. In your name I pray, amen.
Thank you. Thank you so much, Mr. Gonzalez. Right, next, item number 3, presentation of Stanislaus Local Agency Formation Commission highlights. Sarah Lytle-Pinney. Good morning.
Yes, good morning, everyone. Thank you for that introduction. My name is Sarah Lytle-Pinney. I'm the Executive Officer of the Stanislaus Local Agency Formation Commission, otherwise known as LAFCO. So just giving you some quick highlights of what LAFCO is and what we've been up to lately. LAFCO is the local decision-making body that is responsible for regulating city and special district boundaries. LAFCO also regulates certain services, including water, sewer, and fire. In simple terms, you can think of LAFCO as the boundary commission for the county. We are an independent agency, and there is one LAFCO in each county in California. As for the who is LAFCO, the commission itself is made up of representatives from the county, including Supervisors Chiesa and Withrow, with Chair Graywall as an alternate. We also have city representatives, a public representative, and then alternates for each of those categories. We have a staff of 3, including myself, an assistant executive officer who's here with me this morning, Javier Camarena, and a clerk to the commission. LAFCO's goals are to encourage orderly growth, preserve agricultural resources, encourage the efficient extension of services, all while discouraging urban sprawl. These goals often compete with each other, and the Commission must balance these competing goals during its decision-making process. So some of the common projects or applications that we receive, the Commission reviews annexations to cities and special districts. This is when agencies seek to grow or expand. LAFCO also adopts spheres of influence for each agency. Those are the long-term growth boundaries. The Commission approves informational documents known as municipal service reviews for the cities and special districts in our county. These are a great resource to learn more about what services each of those agencies provide. Additionally, LAFCO oversees applications for extension of services outside an agency's boundary. Those include sewer and water extensions, as well as, most recently, fire service contracts. I encourage you, if you haven't already, to visit our website at stanislauslafco.org. The homepage is shown on your screen there. Our meetings are generally on the 4th Wednesday of every month at 6 p.m. here in the board chambers. You can also watch our meetings on your local cable channel, streamed live, or you can view past meetings posted on YouTube, as you can see on the right-hand side there on our website. Of interest, on the homepage on our website, you will find direct links to our current projects and notices. That will show you any annexation that we are currently reviewing that's provided an application to LAFCO. Also of interest, you have an interactive map that allows you to view city and county, city and district boundaries. So this is just an example of what the interactive map looks like. This happens to be a map of all the fire districts in our county. One feature that we've added for users is the ability to click on any district, as you see there, and a pop-up will provide you with links to the district's website, the contact information, their service review document, and downloadable PDFs. And then this is just an example of if you clicked through Stanislaus Consolidated Fire Protection District, you would get a map of the district boundaries, their most recent service review document, and then it links directly to their website for contact. We are good partners. So I've borrowed one of the county value statements, partly because it's my favorite county value, but also because I think it represents how LAFCO functions. We consider ourselves good partners with all the entities we interact with. We freely share our mapping data. We maintain good working relationships with the planning departments, public works departments, the county's GIS division, and elections, as well as the 50 independent special districts. We also regularly interact with state agencies and associations, and we're eager to be an informational resource where we can. Getting to the fun stuff. This is some of our current efforts, and for the board members who are also commissioners, this is a preview of what we have coming likely this year and in the coming months. First up, our updated municipal service review for the fire protection districts will be reviewed by our commission in the next couple months. The draft is currently available on our website for the public's review. Staff is also working on a policies and procedures update that will reflect all of the most recent legislative changes. In the past, we've partnered with the county and the California Special Districts Association to provide free governance training for special districts, and we hope to continue to do that in the coming year. And also, speaking of training, I've also been putting together some LAFCO training for our local city and county planners. There's a twofold purpose for that training, both to educate planners about the annexation process, including the process for streamlined annexations of island areas, and for succession planning by providing more information for those planners who might be interested in LAFCO as a career path. And if you're interested in finding out more about LAFCO, there's a longer LAFCO 101 video and handout linked from the About section of our website. You can also contact us there at lafco@stancounty.com if you have any questions. And thank you for letting me share a little bit about LAFCO this morning. And with that, I'm available if there's any questions.
Any questions from members of the board? Commissioner/Supervisor Withrow.
Well, that was good. No questions, just comments. Sarah, thank you. Sarah's a superstar in LAFCO. We're very proud of her. And LAFCO's a unique animal, and I encourage people to try to get involved in it. And we always say this, we have a lot of committees that we're all assigned to and that we all work on, but all kind of basically to represent the county is what we do on those committees and represents our constituents. But LAFCO is a different animal in that you have to put on a different hat, and you have a different set of rules and laws that you need to follow and a purpose for being there. LAFCOs were established to try to eliminate the sprawls that were happening in California initially, and cities were just annexing and growing like crazy, and there was no control and no real governing body over that, and LAFCOs came into place. And so when we sit on LAFCO, we always say, Vito and I always, and it doesn't happen all the time because it's hard. It's made up of 2 board of supervisors, 2 city councils, and public members. Is that right? And so we ask everybody, we remind them constantly that you need to put on a different hat. You're not here to represent your city. We're not here to represent the county. We're here to represent the rules and the governing body of LAFCO, and which is in place to try to protect the region, basically, for different sprawl. The main marching orders kind of protect ag land. And so it's challenging sometimes to do that. But it's probably one of my favorite committees that I'm on, next to behavioral health. But it is a good committee. It has a great purpose, great marching orders, and I'm very much appreciating we couldn't do it without you guys. So thank you for all you do.
Thank you.
Commissioner Supervisor Chiesa.
Thank you very much. So just to add on to that, I think when an annexation is going to happen and the city wants to grow and they want to build houses, they want to put in a new shopping center, it's easier between the counties and the cities because there's master tax sharing agreements that blunt some of the loss of revenue. But there's so many other special districts, fire districts that count on that revenue, school districts, there's a huge impact on school districts.
when you build more houses. And so you take all of these into account, landscape lighting districts that might be in place, and everything has to be worked out. And that's where Sarah works her magic and her staff. They sit and try and find peace before it comes to us, so that we're not arbitrators of anything like that. But it is truly, it's difficult to learn the rules that we're governed by, and it's tough, as Terry had said, it's difficult to take your hat off, but you have to. And in certain committees, you have to represent all the people, all 550,000 people, what's best for them. So I appreciate all you do. It's a very difficult job. And as a quasi-government agency, or quasi-county, I know that you're county employees, but you're an independent agency. I appreciate all you do.
Thank you.
Thank you. Supervisor Buck Condit.
Thank you, Mr. Chair. Thank you, Sarah, for the presentation. When you talked about the municipal service reviews of the fire districts, what are the goals and objectives of those reviews?
Well, the most recent review is actually an update of one we did about 6-7 years ago. But it's really to give an overall picture of the services being provided, maybe some potential ways to improve those services, but it also provides at least an opportunity for those districts to sort of think about how LAFCO could assist them, either with a reorganization, with a contract, with maybe an alternative way to provide those services if need be.
Thank you.
Any other questions? All right, Sarah, thank you so much
Thank
for
you.
that presentation. I hope some of you can make it to the LAFCO meetings. I think they're the second Wednesday of every month?
Fourth Wednesday.
Fourth Wednesday of every month. So if anybody's got some extra time and wants to learn more about LAFCO, more than welcome to attend the public meetings. Thank you. All right, next we move on to public comment period. We do not have any written comments. As far as open public comment is a time for those in attendance to speak on items not already on today's agenda. Please state your name for the record, direct all comments toward the dais, and so it is fair for every speaker, keep the comments to a 5-minute limit, please. I have a couple comment cards. First one is Linnell Solomon.
Good
Morning,
morning.
Ilana.
Good morning, supervisors. My name's Linnell Solomon, and I am a homeless advocate. I've met with several of you regarding this issue, and some of others may have seen me on Facebook. I'm here to, I usually write down something, so I'm winging this, so excuse me. I'm here to, I never usually venture out to the county territories, but I got somebody told me about an encampment off of 7th Street by the railroad tracks. Made it over there on Thursday, right after a sweep. And the sweep bulldozed these people's tents where they were living. They were given 5 minutes to move. And what did they do? They picked up as much as they could in 5 minutes and moved across the street. Everything is just strewn out in the mud. Okay, this is a sweep right before a huge storm. These people were elderly, or are elderly, and handicapped. 2 of them in wheelchairs. I asked them, why don't you go to shelter? Because they're not accepted there because their care is higher than the shelter can offer them. It was appalling. These people, promised me they wouldn't be there on Friday. I went out there Friday morning, and sure enough, they're there. They were wet, freezing. So, of course, what do? I run them out some tents and sleeping bags. Now, I find this inexcusable. We should not have this going on in this county. I see if these people were asked to move and their roof was taken from them over their head, we need to put them someplace. Can't just tell them to, in a wheelchair, move. What do you want these people to do? Why can't the county and the city get together? If we had a safe camping place for these people, that would not have happened. These people are elderly. These are our people, our community. This could be your parent, your grandparent. It's inexcusable. We've got to find a solution for this. And I beg you to work together with the city. It seems like you guys are just butting heads. You each put it on each other. We got to come together. This is a matter of life and death. I got a call yesterday that on the 16th, one of my people was found dead in an alley of hypothermia. Inexcusable. We shouldn't have this happening here. Please, I beg you, let's do something. This is ridiculous. I'm open for meeting with any and all of you, and I'm also open for any and all of you joining me on the streets. I appreciate your time. Thank you.
Thank you, Lynell. Next comment card is Ron McMurdy.
Yes, Ron McMurtry here. Thank you, Mr. Chairman, members of the board. This is a little bit, got inspired by our last meeting on January 9th, the report given by Sheriff Dirkse, Section 8, Item 2, I'll mention what it is, acceptance and approval of the Sheriff's Office, District Attorney's Office, and Probation Department's AB 481 Annual Military Equipment Report, etc. It got me thinking. A bunch of things kind of dovetailed, so it kind of inspired me to do this little spiel. What I'm really impressed with, my first introduction into local government is through the transit agency, and I've gotten a little bit more and more involved ever since. And I just want to say that I'm very impressed at local transparency, but there's a little more I want to say about that as far as what function it should serve regarding civic engagement for people who aren't engaged in government currently. One of the problems I've kind of noticed at the federal and state level is this lack of capacity for service, because that's where the money is. We have more ambition than the capacity for service, and I want to say that for the most part, I'm very pleased with the local elected officials that they do seem to have that capacity for service here in the county and also at StanCog. I'm very pleased that this body requires your various departments in the county to make reports, same with StanCog, because otherwise, how on earth would the public even know what you guys deal with? I just learned about LAFCO just now. Interesting, fascinating, and a bunch of the other meetings I went to. So I want to bring that up because if it weren't for things like that, things that we don't have to go to a website and look it up. It gets presented so we know, oh, this is a thing the county does. For instance, after the passing of Jenny Conoyer, the Commission on Aging District 3, there was a vacancy. And right away, Nirmal Bassi saw that and said, oh, I wouldn't mind doing that. And now, for instance, the Indian community might get, a little more attention than they have in the past from that commission. And so these are great opportunities for new civic involvement. So I don't have a personal staff to scour the internet and look for, oh, this is a thing you should know about and that thing. And it again relates to Sheriff Dirkse's comment. He kind of resented having to make the report. And he also, mentioned some websites. Oh, we have this and that on the website, but we don't know to look there that kind of information's on there. So I like that these department heads, including the Sheriff's Department, are required to make reports so we know, oh, this is a thing. And then I know, oh, if I want more information, sure, I can go to a website. Okay, it's not good enough. I don't consider it transparency if something's just on a website. I need to know this stuff exists. I don't have time to dig through. So I'm sorry to put an extra burden on the Sheriff's Department, but here we go. So one of the things is that his thing about the use of military equipment, he said that he thought, for example, the armored vehicle got used about once a week on average, but that they didn't keep records of how often they use the military equipment. And I would like to ask this body to please request that the sheriff do keep track, maybe not for training purposes, but in actual police operations. Please, let's have some records on how often the military equipment that he's required to report on does get used. Okay, that's all I have to say. Thank you.
Ron, thank you so much, and we appreciate you making the time to attend the meetings on a pretty frequent basis. Appreciate it. All right, any other members of the public that would like to speak during public comment? Please.
Good morning. My name is Zaf. Lynette, she's my wife. And I just want to add a few words for what she had to say, you know. And I was with her at the place off 7th Street the other day. And I want to tell you that those people, they lay in, I can't tell you even what they lay in while we saw them. But we drove straight home. We had to take our clothes off, put in a washer, and take a shower. They smell, that was unbelievable. And I have to tell you, you know, we always going to the city council meeting. We never came to the Board of Supervisors meeting. And I really amazed. I was telling at one of those meetings, I asked the council members, you know, you and the city put together this beautiful building, you know, and you guys working together. And I can understand why you guys can't put something to fix the homeless situation in this county, in Modesto. You know, a few months ago, the governor said he don't know where 20 billion, the last 5 years he said the state spent $20 billion on homelessness and nothing to show for. You know, and I believe because you guys represent this county, you have some responsibility too for what's going on in this county. Maybe it was the people before you, maybe it's you, it doesn't make a difference. Right now, you in office, it's on you. And between the county and the city, I don't have no doubt, and the monies that come from the state, I don't have no doubt that you guys can fix the problem. And right now, the issue is safe camping for the people on the street. You know, because I keep seeing, you know, all the time, everybody talking about low-income housing and this, and that's great. You know, I'll never be against it. But you have to realize most of those people on the street, if you put them in an apartment today, they won't even make it to a year before they be again on the street. My wife, she helped to put a few people in an apartment. And you know, we have to go over there on every few weeks to make sure that they pay their bills and they do what they have to do, not to go back to the street. And if we'll miss 1 month, that's it, it's over. And to me, it's time for the county and the city. You know what? There is a lot of issues. I'm sure all of you are busy people, you know. But I think it's time to find solution for homelessness. And you know, there's two different issues here, and that's what the city not willing to accept it. There is the low-income housing and homelessness on the street. And they think, you know, and by the way, low-income housing, I think the way the money go on those projects, I think this is one of the biggest fraud in this state nowadays, how they start all those projects, a lot of them they never finished, all over, you can go all over the state, from the north to the south. And I guarantee you, if you really look into it, you realize there's so much fraud into it, with all those non-profit organizations. But that's a different issue. My deal is, it's about time for you people to help to find a solution in this county for homelessness. I know there always be people that are not willing to go with the programs, but the majority of them, if you give them a place, and with all the money around, I think you could probably find a solution for it a long time ago. It's up to you to make the decision first if you want to find a solution or not. And I think it's time for you and the city to work together, to stop blaming each other for this and for that, and to put a program together to get those people, you know, off the street. You know, I go with my wife all the time and I see it. You know, it's heartbreaking to see 75 years old man, Vietnam vet, laying on a sidewalk, peeing his pants, can't even get up, and nobody, everybody come and tell us about the Salvation Army and the mission, but how many really people can they have, how many spaces they have for those people? So it's up to you guys to maybe make a big difference in our community. Thank you.
Thank you.
If I could, Manny, real quick,
Yes, sure. Supervisor Withrow.
I wasn't going to say anything, but I would love to meet with you guys. I appreciate that you came here. There is so much that we're doing here in this county right now. And it's not just about the county working with the city of Modesto. Like, our county works with all 9 cities with regard to our homeless issues here. We can't force people off the streets. It's getting better. I hope the day will come when we actually can force them, that we can involuntarily get these individuals off the streets, because most of them suffer from severe drug, alcohol, and mental health issues. There's a couple great things that are happening recently regarding a pilot program here in this county with our CARE Act, which allows us to not totally involuntarily get individuals off the streets, but get them into services who have schizophrenia. It's a very narrow definition there that we're dealing with. But then there's also, if you come to these meetings more often, you hear, and we can talk about it if you guys would come and sit down with me, SB 43, which is another thing that now has allowed us to classify individuals with severe drug and alcohol problems, substance use disorders, to classify them as gravely disabled, which again gives us another tool to possibly involuntarily get these people off the streets and into housing. A million things going on here that I would love to sit down and talk to you about, and we can go through it. And I agree with you. There's 2 separate issues here. There's homelessness and there's a housing shortage. The 2 don't have anything to do with each other as far as I'm concerned. Housing shortage, affordable housing, that's a separate issue from the individuals who are homeless because they have serious drug, alcohol, mental health issues. For the most part, that's why they're out on the streets. And that's why these individuals, when you see them, they move just across the street and say, why don't we get on the street? We can't at this point force individuals into housing. But we're getting there. I hope the day will come when we get there. And the state is finally moving in that direction more and more. Initially, when they started to address homelessness, and we've done stuff, you're going to see some stuff here. If you hang around for the next presentation that's going to come here, and we've done stuff to try to make this thing happen, but our hands have been tied by the laws, right? The laws of the state of California. Those laws are changing. Things are getting better. They're becoming more aggressive and recognizing that we've got to get these people into services, that's what it's all about, not just housings. We can put them into houses. We've done it. We put these individuals into housing. They're right back out on the streets. I spent an hour last week with a lady walking across the street. I was walking back to my office, and I just couldn't walk by it, and I stopped, and she pants were down to her ankles, peed all over herself. We spent about an hour. I appreciate all the guards here in the building, everything we went through to finally get this lady. But again, it took her to voluntarily agree to go to some place, not something that we could force. Individuals like that, we've got it for their benefit, for their lives, for us to save them life. We've got to get to a point where we can involuntarily get these individuals and get them into services, because most of them aren't in a state of mind that even know that they need services, even know that they're walking down the street without their pants on. So anyway, please set up a time, come in and we'll talk, and you'll see all the great things, a lot of these individuals that are here today, all the hard work that everybody's doing to try to help these individuals and to save their lives. But thank you guys for coming today.
Thank you.
I'm sorry.
Public. Yes, please.
I'm not sure. I'm kind of guessing. I'm not really supposed to direct anything towards any of the county members. I'm just saying, like, from my experience,
Excuse me, sir. If you don't mind stating your name for the record.
Daniel Windle, I'm sorry.
No worries. Thank you.
I met Terry the most. I have met you as the chairman not that long ago, a couple of days ago, maybe last week. I do indirectly participate in the mental health board. So I've been participating really heavily in that. More passively, like with the county, like programs, whatever. I was asked by one of the mental health people, like one of the managers, whatever, if I was interested in maybe trying to join the mental health board. I wasn't sure at that moment because I was still trying to figure out what I was interested in trying to do. So maybe like next year, if there's an opening, I'll try to consider that, and we'll hope there's time. It seems like from being part of the mental health board, a lot of when it comes to mental health and also when it comes to homelessness, they try to, I don't know if I can think of the right word, that's where they try to like resolve some of those issues. And I do know there's like Terry has said, there's some laws or whatever, I don't know exactly which ones, where they're trying to encourage homeless people to get help when they need it, even if they don't want to get help. And I would like to be more involved in that, like figuring out what the laws are regarding homelessness, regarding if there's a specific park we can set aside and designate only for homelessness, maybe tents or whatever, or more potential housing or whatever, or maybe some partnerships with some businesses where they can get write-offs, whatever. I don't know what all the laws are and limitations, but if there's some type of committee or something, I would like to figure out and maybe be involved in it, or Terry can maybe get in contact with Wellness Tommy and get my information forwarded to him, and then maybe Terry can like tell me what's out there somehow.
We're gonna get you involved, Daniel.
Okay, thank you. So I have been pretty involved the last couple of years, and before COVID, I did get the 3 certificates from being part of mental health, probably before I showed you showing up, but yeah, I enjoy it, it's good. And I think you guys are trying to make a difference, so that's good. Hopefully, I think that was within 3 minutes. I'm good.
You had 5, but I appreciate you doing it.
Oh, well. Yeah.
Thank you, Daniel, appreciate it.
Oh, yeah, I'm good.
Right, if there's not, is there any other public comment for? All right, seeing none, this closes our public comment. Next, we move on to our consent calendar. So before the board takes any action on consent calendar, does anyone in the audience wish to provide public comment on any matter on the consent calendar? Seeing none, then I would entertain a motion for the...
Mr. Chairman, I just have a couple thank yous I need to give out on a couple of the consent calendar. A3 and C1.
Do it.
All right.
Do it.
All right.
A3, there was a resignation on the East Side Mosquito Abatement District. Mr. Ron Greenwood served on that commission for just about 40 years. And I would just like to thank him for his service to the community. Also, to Mr. Dave Lehman, our Public Works Director, we're receiving a final update on the Crabtree Bridge over Dry Creek. And I just wanted to thank him and his team for finding a way to keep that bridge open. The people out there that live out there in that rural area were looking at a 30-mile commute if that bridge was to remain closed. So I'd just like to thank his team for finding a way to keep that bridge open. Thank you.
All right.
Motion to approve all consent calendar items.
Second.
Motion by Supervisor Key. All in favor, please indicate by saying aye.
Aye.
Motion by Supervisor Chiesa and second by Supervisor Buckhandel. I should have said it first. All right, moving on to next item is our public hearings, so no public hearings. Discussion items, acceptance of the Focus on Prevention Program Update 2014 to 2023, and presenting the item is Damian Martinez from the Chief Executive's Office.
Good morning. Good morning, Chairman Graywall, members of the board, CEO Hayes, and County Council Bowes. I'm Damian Martinez, Senior Management Consultant with the Chief Executive Office. and I'm here today to present on a program update for Focus on Prevention. I do want to make just a couple quick acknowledgments. First is that Cindy Duenas from the Center for Human Services and Kate Trumpeter from Connect 4 will be my co-presenters today. And I'd also like to recognize members of the steering committee, who you're going to hear about later in the room, and many staff and other individuals in the room today were instrumental in getting Focus on Prevention started. So I'd like to just make those acknowledgments. So I want to give you a brief background on Focus on Prevention. On October 28th, 2014, the Board of Supervisors approved the establishment of Focus on Prevention, which officially began in January of 2015. When the Board of Supervisors unanimously endorsed the Focus on Prevention initiative in late 2014, the supervisors made it clear they wanted to inspire a new way. They wanted to change the focus of local government and its partners from treating symptoms to treating root causes. That whatever could be done was not the sole responsibility of government. A steering committee was established and identified 5 priority result areas: homelessness, economy, education, health, and neighborhoods. The original backbone team, essentially administrative support for Focus on Prevention, began in 2015 through 2022. Though individuals from the backbone team consisted of staff from the Chief Executive Office, Deputy Executive Officer, there was a Manager 2, a Manager 3, a Manager 4, and a confidential assistant. Now I would like to welcome up to the podium Cindy Duenas from the Center for Human Services. Cindy?
Thank you, Damien. Good morning, everyone. It's nice to be in front of you today. I will be giving some highlights of Focus on Prevention for the last 9 years, and then Kate's going to take it from there. In front of you, you see a screen that has the current steering committee for Focus on Prevention. I'd like to just give a shout out to Terry, Brad, Ruben, and myself for, we've been there since the beginning, and I really appreciate some of you, most of you already know this. This was a vision of Stan Risen and Terry from the very beginning to shift the focus in the community to one of prevention versus dealing with all of the things that you heard about today in public comment. And so as you can see from this list, over the years it's evolved. The structure has evolved from a stewardship council to steering committee to these are the 10 individuals that currently make up the steering committee. And it's a strategic group of individuals. These people are involved in several of the very important initiatives that are happening in the areas of focus that we have for Focus on Prevention. And so this is who is doing the work with us at this moment. Next slide, Damien. So from the very beginning, we identified priority areas that were aligned with the county's vision for this to be a community of choice, one where people are well and thrive. Our statements in the 5 areas are, for neighborhoods, our families are supported by strong and safe neighborhoods and communities. And we have several initiatives underway right now to impact community health and well-being. Health, that our families are healthy physically, mentally, and spiritually. Education, our families and young people are getting a first-rate education. And as you all know, we have a Cradle to Career initiative right now that's focused on that, people being educated and from cradle to career, and having that be a foundation for their wellness. And then we have housing. Our families have access to affordable housing at all levels of the continuum. We have now an initiative called Housing Stanislaus that is supporting that effort. And then in the economy, our families are participating in and supported by a healthy economy. So these areas are what we're focused on and Focus on Prevention. And our goal is to come alongside these other initiatives in the community to provide the support to make those efforts successful. So you have seen this slide before. It's just a little historical data about how we got started, some of the work that we were able to accomplish throughout this 9-year period. From the period of 2017 to 2019, we basically started our focus on homelessness, and we heard about some of the struggles people are still having with homelessness in the community, but I'm very proud of the efforts that both the city and county have made, cities and counties have made towards homelessness in our community. One of the things I think that was most important and foundational to the work that's currently happening in homelessness is that there was a system of care established to address homelessness. Prior to that, we had a very fragmented, not coordinated way of addressing homelessness. We now have an access center, we have a low barrier shelter, the Downtown Streets team, which is engaging homeless individuals in employment activities. We, at one point, established an outdoor camp called MOES, as you all know, as a strategy to address some of the changing laws in the community. So, and then very important also, in this same time period, Stanislaus Community Foundation and SCO stepped up and started an initiative, Cradle to Career, where we were really looking at addressing education and having our kids be successful from cradle to career. Next slide. And then I would say that in our evolution, from 2019 to current time, we've been creating conditions for some of the other emerging work that's happening in the community. We published a spotlight kind of identifying the metrics in our community, like what are the statistics? How well are we doing on some of these things? Again, we continued the work on homelessness. Kansas House opened and creating additional housing for individuals in our community. Center for Human Services stood up a youth navigation center, so we have a system to address youth homelessness in our community. And then Project Home Key, there are several other housing and homelessness initiatives that happened during this time period. But also very important is that we now have a very strong platform for the economy and housing areas with Housing Stanislaus and Stanislaus 2030. Next slide, Damien. So one of the shifts that Damien mentioned is that in 2022, we shifted the backbone support for this effort away from the county CEO's office to Connect 4, who is now holding the backbone for the whole initiative. And so we currently have that staffed with a project manager, a part-time assistant, and then Center for Human Services is acting as a fiscal agent. So I'm going to invite Kate Trumpeter, the principal for Connect 4, to come up and share us where we're headed. Thanks.
Good morning, Board of Supervisors. Happy birthday, Manny Graywall. Thanks so much for having us this morning. I'm delighted to get to update you a bit on what we've been up to over the last year or so. As Cindy mentioned, officially we transitioned the backbone role into my organization. We're a systems change consultancy, so I do a lot of work in complex systems and trying to move multi-stakeholder initiatives forward on complicated social and community-based issues. And so as a result of that, we were delighted to be able to hire a project manager. So I do want to acknowledge and introduce Dr. Talitha Agan, who's the project manager for Focus on Prevention. And it's her primary function to be thinking about this every day, which I'm going to talk about just a bit at the end of this. So it's been just over a year since we've been holding the backbone role of this organization. I'd like to just take a minute to highlight some of the work that we've continued to do during that time. One of the first things that the steering committee did just before this transition was identify what strategies they really wanted to be focused on in order to move this important work forward and really focus on what the organizations, the systems, and community leaders needed in order to do work as complicated as improving outcomes and focusing on prevention in the areas of housing, economy, health, neighborhoods, and education. And one of the things we identified was just the need for our leaders and our resident champions to have opportunities to learn about best practices and new frameworks that could support their efforts. And so Focus on Prevention has taken on a sort of training role. We've offered a couple opportunities for folks to get trained in a framework called results-based accountability, which is a framework that's used often in systems change and organizational development to not just help people measure, the numbers about how much people are doing. This will be language that's very familiar to many people in this room. How much you're doing, how well you're doing it, but can we really answer the questions about whether someone's better off? So all the programs and strategies and initiatives that we stand up collectively as counties and cities, as organizations, are wonderful, and we need to be asking ourselves and measuring whether it's actually having the impact on people's lives that we intend it to have. So this is a framework that we're training people on to support them in doing just that. Another strategy that the steering committee has been focused on for the last year plus is just around the use of data to tell good stories, to help us understand our impact. We had an opportunity to support some of the work happening at County BHRS and the Opioid Coalition by doing some surveys with students at MJC around the fentanyl crisis. Talitha continues to work with our local health department, participates in the County Health Coalition data efforts that helps us to align the broader community needs to understand our impact with the kind of data that's being collected by our county organizations. Most recently, we had a group of folks who work in the housing and homelessness space who were very interested in a mapping project, really trying to understand what all the programs and services are that are out there, where the gaps are, how our community can get engaged. And so recently we worked with CSOC, the system of care, to secure some funding to do a project that would help us to illustrate in maybe more layman's terms to the broader community what's happening around housing and homelessness across Stanislaus County, what's going well, where the gaps are, where the opportunities are for people to engage and support these efforts. Maybe not the usual suspects like our business community, our community advocates and volunteers and so on. So we're excited about what's to come with that. Storytelling plays a really important role. One of the gentlemen who gave public feedback or comment this morning spoke about the need for the kinds of presentations and reports that get done in a space like this so the community can know what's going on. And I appreciate that feedback very much, because oftentimes governments do really important work and don't always do the work of bringing community along with them. And that can slow us down. Our community needs to understand the work, how complicated it is, where there's opportunities for them to contribute. And so communications is a strategy that Focus on Prevention cares about a great deal. We need to untangle how complicated some of these things are so that people can engage and have a better understanding of the work that's happening. So we've participated in an affordable housing summit that was launched here. We created a community track with the intention of doing just that, bringing community members in. We paid for registrations and also created presentations that we thought were critically important, like things that we thought community members really needed to understand. We're producing content that we're putting out through blogs, newsletters, and so on. And we're also getting ready to do some work around just what's the prevention message? What does it mean for you to practice prevention in your homes, in your churches, in your neighborhoods? Those will be all part of the communication efforts. And then the last strategy area is really about aligning and strengthening relationships. I'm not going to go through everything on this list, but one of the things that when this initiative was originally dreamt of by Supervisor Withrow and Stan Risen was also about inspiring a new way of working. And that really had to do with being in relationship with people, which isn't about liking each other, although that's always a nice side effect when that goes well. It's really about our willingness to be influenced by other people for us to work together in meaningful and productive ways. And so Focus on Prevention continues to stay really committed to trying to nurture those conditions, make it easier for folks to work together to get things done in meaningful and productive ways, putting out a message and an expectation that this community wants folks to work collectively on issues, because the truth of the matter is that no one person or organization can solve for the things that we're concerned about and that you all put a lot of time and resources into in this community. So a couple of the things that I'll just highlight is that most recently we partnered with County Behavioral Health and Recovery Services to launch a suicide prevention and education coalition. And so Focus on Prevention is providing a lot of the administrative and backbone support for that coalition, which has now met 3 times. We have also, Focus on Prevention provided the facilitation support for Project Resolve, which many of you know is an initiative aimed, or a network aimed at improving trust and strong relationships between law enforcement and community. I'll also just say that in the work on neighborhoods that Cindy Duenas mentioned, most recently we've launched a mini grant program where any neighborhood, any person can apply for up to $250 to host a convening in their neighborhoods as a way to help strengthen relationships and connect people to one another in our pursuit to mitigate this epidemic of isolation and loneliness that we're concerned about, that we know has health implications. The Surgeon General just put out a report about it. So we're very committed to bringing people together, both in service to doing meaningful work, but also just for the sake of connection. One thing that I wanted to add about the importance of relationships and this idea of inspiring a different way of working. When Focus on Prevention started, there was a general consensus that we were doing really good work, but that we might have been doing it in siloed ways, and that we as in like the service providers, county, city organizations and governments, weren't working in really connected, productive, meaningful ways that really could have been better. And so you had different groups like faith, media, philanthropy, government, neighborhoods, business, and the idea of Focus on Prevention was that we could bring all of those people together in service to the change that we wanted to see. And much of that has happened in really meaningful ways. Once Focus on Prevention was launched, it convened all of these important sectors together, gave them opportunities to connect, to move important work together collectively. Anyone from like the Beardland Group and Gallo to Redeemer Church, the Stanislaus Community Foundation, and so on. And as they did that work, you can see that our map became more and more connected. These are called network maps, what you see here. And although we weren't solely responsible, we certainly know that part of the work that Focus on Prevention did led to things like the CSOC, as Cindy mentioned, also Cradle to Career Partnership, Stanislaus 2030, and so on, which is now doing really important work around childcare, the circular bioeconomy, and so on. And so that work never really stops. We continue to try to convene people and to connect them, to give them opportunities to work together towards the change that we seek. And so this is, I know, just a bunch of dots, but ideally a really well-functioning community of service providers and community members and change advocates are working in a way that's really highly coordinated and not separate or siloed. So the last thing I'll offer before I give this back to Damien is just a little bit about what we're learning. We're coming to the end of a 10-year commitment that this body made to the initiative of Focus on Prevention. And there are things that went well and there are things that didn't go well. And we're learners, we're committed to learning. So one of the things that I just want to mention is that we have learned through lived experience that this takes time. The kind of change that we seek in areas of homelessness, housing, health, education, they're generational in time frame and in scale. So you take 3 steps forward, you take 5 steps back. Forward progress is always the outcome that, or the way we seek to do our work, and it just takes a long time to move complicated things along, just like it took a long time for us to end up where we are now. We're also not going to program our way out of any of this, and what I mean by that is that we're not just going to stand up new mentoring programs, a new housing project. Those are fabulous and they need to happen, but it can't be singular in that way, the solutions to the things that we're trying to solve for. The other thing that we just have learned a lot about is that red tape and process within these systems are barriers. So our systems are complicated. When I talk about systems, I mean government, I mean businesses, I mean our known and habitual ways of doing things. And that oftentimes really good ideas will fail because we can't take risks, we're afraid of risks, or because there's a lot of red tape that gets in the way. And so we're doing a lot of work to figure out how to work around the complexity of these systems, right, that often fund our work and so on. But there are just lots of barriers that exist in these organizations that have really good intentions. The idea that we have to continue to work to what we call maintain alignment. Those maps that I showed you where all the dots start getting closer and closer together with stronger connections, that takes work too. That doesn't happen on accident. So the work of moving a lot of people along towards the same thing means that we need to be paying attention to our relationships, to the quality of our interactions with each other, and we're paying attention to the quality of your interactions with other people too, right? Because the system has to continue to stay connected in that way, and that just doesn't happen on accident. And then the last thing I just want to say is that one of the reasons that we moved the backbone work into an organization outside of the county was that the county, your work is very complicated and you have lots of priorities. What the steering committee knows is that someone has to wake up thinking about this work every day. It has to be their job. There can't be other duties as assigned, right? And so we've been very grateful to have had the opportunity to staff this for the last year plus. And we very much look forward to the time that we have left and whatever may come after that. But we do think it's a really important move to just have a person whose job it is to wake up thinking about what Focus on Prevention needs to do today and 6 months from now. So I said that was the last thing I was going to say, but I have one additional slide, and then I'll give it to Damien. We know we're coming to the end of this 10-year mark. We have some time, and we've been thinking about what's left for us to do. You have heard about Stanislaus 2030, Cradle to Career. There's a housing initiative being stood up as well. Health is an area that we are still very, very passionate about, community health. So we're talking actively about this last focus area and what it would look like to launch a health initiative. We're very, very interested in what we're calling, and others are calling, the epidemic of loneliness. So we're doing a lot of work around the health outcomes that can be improved by just making it easier for folks to connect with one another and not experience isolation. And also there's more mapping for us to do. We know there's a lot of really important prevention efforts happening in the county and in the world, and we intend to spend more time identifying best practices, finding new funding to bring into this community to elevate prevention activities, because we know that addressing root causes is where our work is at this moment. Okay, thank you for that. I'm going to give it back to Damien.
Thank you, Kate and Cindy. So I'm going to end the presentation with a budget overview for Focus on Prevention and then with staff recommendation. You can see here that the Focus on Prevention annual budget during the first few years that funds weren't utilized as much as during the middle 3 years. And so now the font type is small here. The darker colored orange refers to the amount that was returned to the general fund, and the very light orange is the fund utilization for Focus on Prevention. The next slide for a summary slide will explain it a little bit clearer. So you can see here that the Focus on Prevention budget summary from fiscal year 2015 through 2023, the 9 full years for Focus on Prevention, is that on the left, you'll see the darker colored orange was the net county cost general fund utilization, those funds that were actually used by Focus on Prevention, 47%, 4.2 million. And then the very light colored orange refers to the amount that was returned to the general fund, about 4.8, 53%. I did include 2 slides that for some clarification purposes. This slide refers to the fund usage by expenditure category. So you can see that a bulk of the funds were used for salaries and benefits, contracts. You can see about 1.4 million. There was a time for the Outreach and Engagement Center where funds were used from Focus on Prevention, rents, leases, and then other expenses. And as Cindy mentioned at the outset of the presentation, and I mentioned very briefly that there were 5 focus areas, and as she mentioned, a bulk of the funds used by Focus on Prevention were for housing, so you can see 2.9 million, and then you can see that with education, neighborhoods, health, and then the economy. And I'd like to end with a staff recommendation to accept the Focus on Prevention program update for the period beginning July 2014 through December 2023. And we are available for any questions that you may have. Thank you.
Thank you for the presentation and everybody that was part of the presentation. Any members of the Board of Supervisors have questions for Damien or any of the presenters?
Just a quick comment about Supervisor Withro's leadership over the years on this. We talk about this all the time, about how we kind of get areas of expertise, but this is a little different because this was a new program. And I remember the first couple of meetings, and I'm going to go back, we probably started talking about this back in 2013 or 14, and it took quite some time to come to fruition, but without your steady leadership, none of this would have been possible. Thank you.
Thanks, Vito. So this has been a team effort. We always try to point out each other's maybe things that we're involved in, but none of this happens without all of us being involved in this. So anyway, I'm going to thank my fellow board members for everybody participating and being a part of this and helping make this happen. I want to thank everybody who's here, who's just here today, and most of you have kind of been involved since the beginning. Ruben Imperial, of course. Damien, I appreciate everything you've done. Cindy, Brad Hahn, Kate, as you've gotten involved, and Talitha through this whole thing. Heather, I see Heather Duvall out there. Anyway, all of us have been, doing all we can. It's amazing, 10 years. Geez, are you kidding me? 10 years has gone by since we started getting involved in this stuff. So thank you, Tara. That's the biggest thing. Thank you, everybody, and all the work you're doing to try to make a difference in the community. When I look at Focus on Prevention, what we've done, and there's a ton that we've done. We've listed a lot of it here. A lot of stuff isn't even listed here. It really comes down to, I think Kate said it at some point there, was relationships. And just it kind of changed the way, for me, I see it as it's changed the way since I've been here, how the county does business and how the county has been doing things really since we kind of got this thing started. And just like I said, relationships amongst our board members, just how we, get along with each other and get things done, even though we don't agree on things. And it's just, again, we've built unbelievable relationships here on the board with our current board, with our previous board members, and then with our cities. Look what we're doing with our cities now. The amount of, at least what I feel since from when I started till now, the stuff that this community and our board has done as we work with our cities, tax sharing agreement that we a couple of years ago put together. It's been a couple of years, I guess, since we changed that, and stuff that just wasn't happening because the relationships weren't there. We just weren't all working together and thinking on the same page. Our departments, I look at how our departments work together now, and again, this isn't all as a result of Focus on Prevention, but it's just we got into this mindset of relationships, of building relationships. I look at our DA and our public defender and our sheriff, and I see the things that are going on and just that never happened before, that just those relationships weren't there, so they couldn't happen. And I see it's like crossing party lines, we're getting things done that just didn't happen. And then just with our public, just getting the public involved with government, where in the past it's been the public would sit out there, the private sector, and just we'd throw stones. I was one of them, throwing stones at government. What are you doing? You guys get nothing done. What an inefficient. And we've got the private sector working with us through all these things. Probation. I saw Mark back there too. Same thing, just working with everybody. And so, anyway, just great things as a result of relationships have come out of this and will continue to come out of this. And again, it's been a team effort. It's been everybody who's been involved in making this thing work. And I really feel like we've changed the way we do business here in the county now, not just amongst the staff and our departments and the board, but the public too. So thank you guys for all you're doing. Look forward to a lot more, another 10 years of great stuff. Thank you.
All right. Taking that to the public, does anyone in the audience wish to provide public comment on this item? Daniel.
Go up there?
Yes, please. Grace us with your presence at the podium.
Okay, my name is Daniel Wendell. I wrote notes regarding what I heard her talking about. And one of the areas, it sounded like she said still maybe needs to be I don't know if I know how to say it right. Addressed still better, more, is she said maybe some type of mentoring program. Like I said, I feel like I'm pretty heavily involved in certain county programs, and if someone needs like if I go to hear the supervisor meeting, or if I go to the mental health board meeting, or any other type of places I might be involved in with county or whatever, if it's potentially involving homelessness or something related, maybe I can, like, if the county or whatever wants me to, I can try to take notes or whatever, and keep track of ideas and whatever, and if there's an office or someone I can forward to, and try to figure out if you guys want to do some type of mentoring program, what potential opportunities there are, because I would like to be more like directly involved in the community. Like, even though, like, say I'm helping out with SRC, Stanislaus Recovery Drug Rehab, like when it comes to mentoring in different areas, I don't really see it. I don't know of it, and or even mentoring homeless people. I don't mind, like, if I have free time, I don't mind, like, trying to participate with them. I'm comfortable with them. I have a health problem with my mind. As long as I don't feel like they're a threat to me, I'm willing to work with them. So, and I don't see an opportunity either for like anybody in the community for helping people who need help for mentoring. And I'm open-minded to that, and it would be nice if it exists to know of it, and if it doesn't exist to put it into existence. And then she said something about housing. Well, there's a lot of potential housing out there. It needs to be all linked up. Like, I guess there's probably a website somewhere on the county's website. Well, maybe there's a steering committee website, whatever. And I'm sure a lot of his stuff is maybe on that website, some of what she was talking about. But when you go to Google and you want access to different information like mental health services, whatever, and I put the county or the city, it would be nice if I just put I need help or whatever, or I'm mentally ill, or I'm a drug addict or whatever, and then the county or city, and then Google pops up with a list of agencies can give them help, or even a really good clean-cut county website specifically for helping agencies. And I've typed different things in Google and I have never seen it. And I think there's a lot more potential for a clean-cut website to make access easier for everybody. So that would be nice if that's possible. And maybe, like, if I'm allowed, like, try to help design it. I don't know. I don't know what all I have to try to make sense of it and see what you guys are willing to try to do. See ya. I guess that's it.
Thank you, Daniel.
Yeah.
Dan, I'm just going to say, Daniel, careful what you ask for. We're going to put you to work here, so.
Oh, well.
Yes, please.
I just want to talk about what the lady just said, and I'm not going to give her any argument because I really don't know, but she talked about projects that going for the last 10 years. But the bottom line is, with all the respect, every year there's more and more people out there on the street. So obviously something is wrong. You know, and I think one of the issues here, first, there is a lot of people on the street who's helping the homeless people. And I don't know, I noticed with the city refused to talk to those people. Just absolutely refused to talk to them. And I think if all those programs, cities, counties, those people who run those programs start to talk to those people, maybe they get some different look at the situation. And another thing, she talked about relation, and I agree with her about relation, but I tell you where relation are missing. It's between the people that working for the county and the cities who run all those programs, going to the street, but they don't have no relation with the homeless people. Homeless people, when they see somebody from the county or from the city, you know what they do? They call people from the share organization. They don't want to talk. They don't trust them anymore because they keep failing them for time after time after time. There's a lot of programs. You need to show up. If you have an appointment, they open the office at 8 o'clock, you need to show up there at 6 o'clock to make sure that they see you to help you that day. You know why? Because they only help maybe 3, maybe 4 people every day. So it's okay to talk about 10 years programs and all this stuff, but I'm telling you, we try to talk the city to start some. We told them, you know, if somebody is bleeding, the first thing you do is stop the bleeding. Because if you try to do something, he may die from bleeding until, you get him to whatever the treatment you give him. And one of the things that need to be done today, I think, it's a safe camping for all those people on the street. Because those are the people that suffer the most. Now, the police department, the sheriff department, they can go and push them away to another place, but they don't put them in a place for them to live. And I'm not a lawyer, but I found that actually there is a court ruling that talk about if you get somebody off the street, you have to put him in a place. You can't just push him from one side of the street to the other side of the street. To me, it's illegal. So I think there need to be relation with the county and the cities, with the people who helping and advocate for the homeless, and also with all those organizations, all those programs, counties, cities, to build trust with the homeless people on the street. Because I tell you what, I found going with my wife, most of them not hungry, most of them need attention. And when my wife takes her time and stands up for an hour and talk to people and shows them that she follow up on the issues, calling them back, texting them, middle of the night too, they know they can always reach her. This is how trust build. And I think this is what you guys need to do. You need to get together there is a great organization here in town, SHARE, run by Steve Finch. Talk to him. He can educate you about a lot of issues when it's come to homelessness. Thank you very much.
Excuse me, sir. Did you need it?
Did you get it? Did you get it?
It's F.
It's F. Sullivan.
Yeah, he had spoke once. Yeah. Right. Any other members of the public would like to speak on this issue? Seeing none, I'm going to bring it back to the board, and I will entertain a motion to accept the program update.
I will make a motion to accept our program updates, and thank everybody.
Second.
Got a motion from Supervisor Withrow and a second from Supervisor Chance Condit. All in favor, please indicate by saying aye.
Aye.
Aye. All right, thank you. That wraps up. So correspondence, acknowledgement, receipt of correspondence, and refer as recommended on the agenda. Board of Supervisor reports. Any Board of Supervisor reports? All right. Legislative, fiscal, and management report. I have Gavin Klein from Congressman John Duarte's office. Good morning, Gavin.
Good morning, Mr. Chair, Vice Chair, members of the board, county staff, community. Thank you, Gavin Klein, Congressman Duarte's office. Mr. Chair, happy birthday. Congressman Duarte has continued to advocate for California's 13th congressional district at our nation's capital in D.C. Congressman Duarte has voted for every continuing resolution to keep our government open and working for families in the 13th district. It's important that we continue addressing our government spending problem while we also make sure we're minimizing the disruptions of the federal programs that so many of our constituents rely on. We have to make better spending decisions to ensure that we do not bankrupt our country's future. This was the best option available to us in the moment. Congressman Duarte remains hopeful for the 2024 fiscal year budget that it will include common sense decisions on government spending to cut inflation and revive our economy. Our office, I've had the opportunity to talk about the military nomination process at this board before. We had a great interview process in 2023, and Congressman Duarte was able to give multiple nominations out to the United States Naval Academy, Air Force, Merchant Marine, and West Point. It was a great opportunity for our youth for their service, so really excited about that and wanted to share that with you, and thank you all for your time.
Thank you, Gavin. All right, our Chief Executive Officer.
Good morning. I have a couple of things to report. The first is I just want to share with the members of the public as well as update the board. I think you've received some of this information previously. We were originally scheduled to come back before you next Tuesday on January 30th and provide you an update on our analysis of implementation of SB 43, which is conservatorship expansion opportunities in the state of California. Unfortunately, we're going to have to delay that item by 1 week. We had some matters pop pop up that were unforeseen and really don't give us too much of a choice. So we're going to have to push that presentation back to the board. It'll occur on February 6th. I know this was a topic of discussion previously, so I wanted to make sure I stated that publicly here. We'll be on February 6th for that conversation. And then the next matter I want to do is just provide you a simple overview of our initial readings of the 2024-2025 proposed state budget that was released by Governor Newsom earlier this month. And in doing that, I think it's important to just acknowledge that it's really difficult at this stage to know exactly what the budget's going to look like. And we'll be bringing more reports to you when we do our standard budget updates and so forth. But we wanted to at least give you a sense of what we see in the release of that budget and what we think could be at risk given our initial analysis. I definitely want to acknowledge that the final budget that's approved by the state is oftentimes very different than what's released in January. So we're not sure what will be approved ultimately. And that we do see some conflicting information in different news reports about what's happening. And perhaps I think the most important conflict in information that you see reported out there is just how big is the deficit with the state of California. The governor's budget of $291 billion does contemplate a $37.9 billion shortfall due to various revenue issues. However, the Legislative Analyst's Office had previously reported a $68 billion shortfall and then acknowledges some updates to those numbers. But as we sit here today, there's definitely a difference in Sacramento about how big the budget deficit is. Everyone does agree that it is sizable and it will have significant impact in this upcoming fiscal year as well as beyond. The governor's proposed budget is balanced in some simple categories that I'll just reference. First off, and definitely worthy of headlines, is the use of $13 billion in reserves. In addition, there are reductions in this budget of about $8.5 billion. And one of those that we were very mindful of trying to watch was the $5 million that was allocated for the South Modesto infrastructure projects. There was a special allocation in this current year budget, and we've already received that funding from the state of California, so it'd be pretty hard for it to go back the other direction. But I do want to acknowledge that all kinds of different programs, promises, and allocations that were in the current year's budget may be at jeopardy of not even occurring in the current year. So I think local governments are very concerned that some of the plans and things that we've set out to do, even in current year or next year, if you haven't received those funds already, could be at risk. So just wanted to call that out, that the largest allocation we received is secured here. There's also internal borrowing and revenue of about $5.7 billion. It's very common for the state to shift around funding sources in times like this. There are a significant number of spending delays, and we actually think this is going to be where some of our greatest impacts are, but that's about $5 billion. Additional funding shifts of $3 billion, and then deferrals of about $2 billion, pushing costs from one fiscal year into the next year. So we did ask our county departments to give us their understanding of the state budget and provide us any just very kind of headline items that we need to be tracking and what we're trying to dig into. So I'm just going to read a couple of those so that you're familiar with them. The first category, and it's been a hot topic this morning, is around housing, particularly to support many of our most vulnerable citizens in the community in our efforts to expand housing opportunities and affordable housing opportunities, permanent supportive housing opportunities. The state budget does shift about $275 million between funds and then delays another $235 million in state general funds from this upcoming fiscal year to the following fiscal year. This may have a direct impact on our ability to support a new 30-bed interim housing facility that we had previously planned in partnership with the City of Modesto. So we have a very specific plan partnership that we've been putting together with the City of Modesto, previously presented to this board on November 7th of last year. So if you're interested in learning more about that, you can learn more about that particular project, and I know Modesto's reported out on it as well. However, we were contemplating about $10 million in funding, and we're not 100% sure that we'll receive all of that allocation that was originally contemplated. Some of the delays in funding that we're tracking is one of those is a program that we refer to as our Bringing Families Home program. This is funding to support services for child welfare clients. and their parents to pay for housing subsidies and prevention of losing housing. So again, another housing-related program. The Home Safe program is going to result in a delay at the state. This is about $700,000 here locally. This funding provides for adult protective services clients to pay for emergency shelter or to prevent prevention activities for homelessness. Very, again, much in line with a lot of the things we've been talking about this morning. We have also been looking at different ways to leverage these funding to support the financial challenges that we're experiencing at the Salvation Army shelter. So some of those funds are at risk. The Housing Disability Advocacy Program, there's a $50 million delay between fiscal years. The specific amount, that's statewide, but the specific amount in Stanislaus County is unknown at this time, but we're guessing anywhere from $250,000 to $300,000. And this does support individuals with disabilities who are not yet enrolled in SSI and usually are waiting for SSI to be finalized. But more directly, it does impact our ability to potentially pay for some shelter beds for individuals who are out on the street that fit that criteria. There are future programs that have yet to come online that are now at jeopardy, and one of those that we want to call out is expansion of substance use disorder treatment. So I know that there's been quite a significant effort to improve our substance use treatment program systems in our community here, and we had previously the budget had forecasted that in future fiscal year 25-26 there would be funding particularly to support the partners agencies that we work with for those drug treatment programs, and those appear to be no longer viable if this budget proposal continues. There are a couple of things that we saw that were positive development, not necessarily growth in programs. However, they were things that were at least being maintained that we were concerned about. So there's about $1.5 billion in funding for immediate housing and treatment needs for unsheltered homeless that include serious behavioral health conditions. So Supervisor Withrow mentioned our Care Court program earlier. So this budget does preserve much of the funding that we were expecting to be able to operate Care Court in the current year and in the upcoming year. Medi-Cal impacts. We're not seeing any specific cuts to the Medi-Cal population, but it is important to note just how serious those types of cuts in the future, should they occur, would be in this community. Our latest data shows that 276,000, or that we have 276,000 Medi-Cal beneficiaries in Stanislaus County. That's almost exactly half of our county population is receiving services through Medi-Cal. So the budget does preserve those investments that have been made to date, including some of the expansion of benefits to adults Medi-Cal population, regardless of immigration status. So those things have been preserved in this budget. I want to note that of our Health Services Agency clinic system, about 84% of the patients that we serve in the county clinics are included in the Medi-Cal population. We also are anticipating a positive impact on expansion of benefits that would provide Medi-Cal leveraged dollars for our behavioral health services that were not previously covered. So there were some plans in the works to improve the Medi-Cal system across the entire state. So far, the governor's budget attempts to preserve those plans, and we hope that that they're capable of doing that, given the next rounds of budget acts that they may need to take. Also want to note that we are anticipating increased caseloads of about 10% in the CalWorks program. That's one of those just kind of benchmarks in terms of how things are going in the economy and so forth and with employment. There are other delayed improvements in the system. One of those was what we have an employment services program through our community services agency that seeks to improve our work with clients who are transitioning from cash aid programs into the workforce. So some of those improvements that were contemplated will be delayed. We don't see any major impacts to 1991 or 2011 realignment programs, but those are some of our major funding sources that can really have an impact on our health and human services programs. We're not seeing anything major at this time, but that's like when you analyze the budget, that's one of the first places we go to look. Child welfare services and foster care. CSA is looking at about a $4 million decrease in services. The state is saying that this is a reduction to, or I'm sorry, they're saying it's related to a reduction in caseloads. However, we haven't been able to validate this yet. So yes, there may be a decrease, but it may be warranted based on caseloads, and we'll follow up with that as well. There are a few other programs that are at risk that I just want to mention. One of those is our Family First Prevention Specialty Program, and that funds supportive services for children who are at risk of entering foster care. It looks like they're maintaining the budget allocation there. However, another program called our Family Urgent Response System that provides 24/7 crisis response and support for children, transitional age youth, or their families in foster care. This is a contracted service with the county, and it does appear that the state would close funding for that particular program. And then one other program, and I'm sorry I just keep on ringing these off, but it's important to just understand the breadth and all the different programs that we operate at the county and how some of these are either positively impacted, not impacted at all, or negatively impacted. So our Housing for Foster Youth and Supervised Independent Living Placements, or our SILP program, does face at least 1 year of funding in this budget, but then closes the program 1 year after that. We're not seeing any specific changes in CalAIM or the investments, local investments that the state has moved forward for public health programs. You'll recall after COVID, the state did set aside funding to try to support local public health departments, and so far in this budget, it appears that that is holding. And then we're going to kind of wrap this up. We do have, so there's a reduction in multifamily housing funding, and this could potentially affect various projects that we currently have underway in the community. But one of those projects that's contemplated in the community that's attracted some attention is what's referred to as Morris Village, which is a 45-unit program in the city of Modesto that we're working with them on. The reductions in multifamily housing funding would certainly have an impact to that particular program that requires all kinds of funding sources in order to be in order to come to fruition. And then the last note that I'll make is not the Stanislaus County organization, but this budget does include increases for the state of California to maintain their obligations for operations and maintenance of the new courthouse facility that is scheduled to come online sometime in fiscal year 24-25. So there's some more funding there. However, we're most particularly interested in how the state may fund increased court security costs, because we already have challenges and we're operating in a deficit position to provide safety within the current court operations. We want to make sure that the state of California partnership includes safe courthouse operations once the new court facility is opened. I'm going to go ahead and conclude my remarks there and welcome any questions, and if I can't answer them, we probably have staff who might be able to.
Any questions? Members of the board, public? Well, I wish we had better news, but it looks like there's going to be some challenges ahead, and I appreciate the CEO's office already identifying those and how we're going to work to overcome them. With that, I appreciate everybody that took the time to come to today's meeting, and I appreciate Deputy Herr for looking over us. And now I will adjourn the meeting at 10:28 and then ask the County Council to report on closed session items.
Yes, we have closed session this morning. We have a conference with legal counsel, significant exposure to litigation. That is pursuant to Government Code Section 54956.9, Subdivision D2, Word 3. We have one matter to discuss, and with that, it would be appropriate for public comment.
Any public comment? All right, seeing none, we'll adjourn to closed session. Thank you.